This video illustrates simultaneous sigmoid colectomy and liver metastasectomy for CS sigmoid colon and synchronous liver metastases. This 27-year-old gentleman presented with abdominal pain and constipation. His tumor markers were normal and a CT scan of abdomen showed a sigmoid colon mass with regional lymph nodes and multiple liver metastases. As you can see on CT scan, there was a large metastasis on the left lateral segment and there were two large metastases on the right lobe of his liver. And in the pelvis, you can see there was a large mass in the sigmoid colon with small regional lymph nodes. A midline incision was kept and the abdomen was explored. There was no ascites and the omentum and peritoneum was free of tumor. Now the sigmoid colon was mobilized and the pedicles were ligated. You can see this was a large sigmoid colon mass. The radical sigmoid colectomy was performed and the hand-sewn anastomosis was done. Now in the upper abdomen, the liver was mobilized. After mobilization of the liver, you can see here in the left lateral segment there was another nodule which was not seen on the CT scan, and this was a large metastasis in the segment 2 and 3. And on the right liver you can see this was large metastasis and one another metastasis close to the gallbladder. A total 4 metastases. An umbilical tape was passed for the Pringle maneuver. The left lateral segmentectomy was performed first, so the stay sutures were taken on both the sides. The line of transection was marked on the liver surface with the help of diathermy. Parenchymal transection was performed with the help of monopolar and bipolar diathermy and Kuza. Larger pedicles were ligated and divided. Parenchymal transection progresses further after dividing all the pedicles. So parenchymal transection progresses further and you can see we are approaching the left hepatic vein there. A spoon clamp was applied and the left hepatic vein was divided. So that is segment 2 and 3 with one large and one small liver metastasis. Left hepatic vein orifice was closed with the help of fluoroproline in 2 layers. Now, cholecystectomy was performed and a catheter was placed in the cystic duct. The metastasis at the base of the gallbladder was marked and the metastasectomy was performed. Parenchyma was divided with the help of diathermy and Cusa. You can see the dissection was done from both the sides with a clear margin. A pedicle was clamped and it was divided and the metastasectomy was completed. So that's a metastasis with a clear margin. An intraoperative ultrasound was performed, as you can see here. The line of transection for the metastasectomy was done with the help of diathermy. You can see here the metastasectomy was completed. So that is the metastasis with clear margin. A methylene blue test was performed to see for the bile leaks and a small bile leak was closed with the help of 5-OPDS. The cholecystectomy was completed. So that is the final picture. You can see 2 metastasectomy on the right side and that is the left lateral segmentectomy for segment 2-3 liver metastasis. Thank you.